Hi, everybody. Welcome to the Cancer and Financial Toxicity presentation. We're going to get started in just a few moments, so please stay with us. We'll get started soon. Hi, everyone. I'm so excited to share with you today the Cancer and Financial Toxicity presentation. Although I'm a lawyer, today's presentation is not legal advice. This presentation also does not establish an attorney-client relationship. This is the Cancer Legal Resource Center, and we are a program of the Disability Rights Legal Center based in Los Angeles, California. We're an educational model, and we'll do intakes in English and Spanish, and also have a language line for speakers of other languages. All of our services are confidential. A special hello to the audience members from Komen, Orange County. I'm going to do my best to leave time for questions at the end of the webinar. Hopefully, I will be able to answer your questions, but if I'm not sure, or if you have questions that come up down the road, this is the best way to get in touch with us, either filling out an intake or calling our toll-free number to leave a message for someone to call you back to complete an intake. All the information we provide is free, though we do not provide legal advice or direct representation. The CLRC also maintains a library of fact sheets on a variety of cancer-related legal issues on our website, including a resource called our Patient Legal Handbook. This handbook provides a brief overview of many of the most common issues and questions that people living with cancer and their families have. And we'd like to give a special thanks to the handbook's generous sponsors, the American Cancer Society and Breakaway from Cancer. If you're interested in receiving large number of copies of our handbook, please submit a bulk order on our website. We also have PDFs of the handbook in English and Spanish available to download for free. Now let's move into the presentation. We're going to cover financial resources in connection with the COVID-19 pandemic, but first let's get the basics covered. Obviously, cancer is an extremely expensive illness, even for those who have, quote, good health insurance coverage. So what is cancer-related financial toxicity? It's essentially financial distress or problems that affect people with cancer due to the cost of treatment. Because cancer treatment affects a patient's ability to work and pay bills, financial toxicity is often caused by loss of income. And even the best insurance doesn't cover 100% of the costs. So having a good job with good insurance doesn't always prevent financial burdens or toxicity. This is especially true when you take into account transportation, parking, and potentially housing and other hidden or indirect costs. And it can be difficult to get coverage for those costs, even with the best insurance plans. According to the Kaiser Family Foundation, medical debt is the #1 reason for bankruptcy filings in the US. A 2017 study in the American Journal of Medicine found that more than 40% of patients depleted 100% of their assets, an average loss of more than $90,000 within 2 years of diagnosis. A 2019 study in the American Journal of Public Health found that 2/3 of bankruptcies were associated with medical issues, either due to high medical costs or income loss from time off work. There are a number of ways to help minimize cancer-related financial toxicity, including consumer protections, debt management, optimizing and maintaining health insurance, and of course, income replacement. Cancer is one of the most expensive medical conditions. Insurance, copays, and coinsurance are just one piece of the financial toxicity puzzle. Most everyone will have some or a lot of out-of-pocket costs. Prescription drugs for cancer are often more expensive than those for other conditions. People have to take time off of work for treatment and recovery, and family members may have to take time off as well. For a person who has a recurrence of cancer or has multiple cancers, the medical costs and loss of income are even greater. And if you want more data on financial toxicity, the National Cancer Institute has some published articles and studies on their website. Health insurance is important. The first step in preventing or minimizing financial toxicity and to address practical financial concerns is to have and understand how to use health insurance. I'll talk a little bit about health insurance options today and options for healthcare if you can't get insurance. And I'll go over information on insurance appeals. Again, this is going to be a quick overview. Despite the fact that we look to our doctors and all of their healthcare providers to know everything they need to about our health and make informed decisions about our care, they aren't necessarily the ones responsible for making sure that the care they recommend is covered by our insurance plan. It's the patient's responsibility to understand their own insurance coverage. Having an understanding of what is covered and what cost sharing is required can help a patient plan ahead for their finances and avoid unforeseen costs. In fact, a recent national survey published in the Journal of the American Medical Association, or JAMA, found that nearly 30% of insured adults surveyed reported having delayed or foregone care because of cost. Higher health insurance literacy was associated with a lower likelihood of delayed or foregone care owing to cost for both preventive and non-preventive care. Basically, the takeaway, and this means that if you have a better understanding of health insurance coverage and how it works, you'll be less likely to delay or forego care because of cost. Step 1, find out information about your policy. Your summary plan description or evidence of coverage description usually can be found online on your plan's website. If you're working, contact your Human Resources Department, get a copy of the plan, and get familiar with your policy. I understand that this can seem intimidating or boring to read through the policy, but it's well worth your time. You should become familiar with your copay, deductible, and co-insurance responsibilities, and also be aware of any services that might require prior authorization. Additionally, it is important for you to understand your insurance network and whether there is reimbursement for out-of-network services. Always contact a provider directly to confirm whether the provider accepts your insurance. Even if a provider is covered by insurance, it may be difficult to predict exactly what your out-of-pocket costs will be given your deductible, copay, and co-insurance responsibilities. Of course, having insurance in the first place is one huge step towards addressing practical financial concerns. One or more of the following options may still be available to you. I won't go into a lot of detail about these different options, but suffice it to say that you should be aware of your insurance options. We have additional resources available on our website. Employer-sponsored or COBRA may be an option if you're leaving your job or have lost your job. This option can be expensive, but can help maintain coverage after employment. An alternative and potentially less expensive option would be to purchase a new plan through the state marketplace. Some states have their own private marketplace, while others use healthcare.gov. It may be tempting to buy the cheapest plan, the one with the lowest monthly cost. But some of those plans with lower premiums may end up costing you more in the long run. That's if they have higher deductibles or higher out-of-pocket costs. When you enter in your income on the website, you'll learn whether there are tax credits to help you lower the cost of your insurance premiums each month. The same is true for short-term health plans. They may be cheaper, but they likely don't provide the coverage that someone would need if they get diagnosed with cancer. Medicaid is a health coverage program run by the states. Eligibility is traditionally based on low income, low assets, and disability. With Medicaid expansion, many states have expanded eligibility by having only an income-based requirement. Medicare, that's available to people who are turning 65 or those who have been eligible for SSDI, which is Social Security Disability Insurance, for 24 months. The most important thing I'll mention about Medicare is that we hear too frequently from people who opt to not sign up for Medicare when they first become eligible due to already having other insurance or believing the card was sent to them in error. If you're nearing Medicare eligibility, either age or SSDI, please make sure you fully comprehend potential downfalls of not signing up during the initial enrollment period. Premiums can be significantly elevated if you do not sign up during that initial eligibility period. If you can't get healthcare otherwise, here are some other options. Private health insurance. Although this can be an expensive option, anyone can purchase private health coverage as long as they do so directly from an insurance company or through an insurance broker. Some people are not eligible to purchase through the marketplace due to immigration status or Medicare or Medicaid eligibility. Hill-Burton is a law which gave hospitals and other health facilities money for construction and modernization. In return, the facilities that received these funds agreed to provide a reasonable volume of service to people unable to pay. While the program stopped providing funds in the late 1990s, certain healthcare facilities are still obligated to provide free or reduced cost care. You can call the national hotline to get a list of obligated facilities. Charity care. Many hospitals have free or low-cost care available to low-income patients. Speak with a social worker, financial navigator, or the patient services personnel at your local hospital department to determine what options may be available. You often have to provide information about your income and other assets. If you're insured but are concerned about outstanding medical bills or the best ways to use your insurance coverage, these tips can be helpful. Here are a couple of things to keep in mind to make sure you get the most out of your insurance policy. Check with your insurance company to see if they offer a case manager. If your plan or hospital does not offer case managers or patient navigators, ask to speak with the same person each time you call if possible. Positive rapport can go a long way, as the insurance employees may be willing to spend time finding ways to reduce costs. It's the hospital case manager that makes sure a patient's health insurance company understands what's happening during the patient's hospitalization. They make sure the insurer has all the information it needs to approve payment for the hospitalization and works to prevent insurance claim denials. They communicate with the health insurer's case manager every day or every few days. Additionally, a hospital case manager might negotiate coverage benefits between a health insurer, provider, and the patient. The health insurance company's case manager receives information from hospital case managers, home health care companies, physician offices, social workers, and other healthcare providers. It can be awkward to have conversations about costs with your providers. I totally get it. But at the end of the day, if you can't afford the treatments or prescriptions your provider is recommending or aren't adhering to the schedule of dosing because of cost, your provider needs to know. They can't help or recommend less expensive options if they don't know your situation. Keep dates, times, and extension numbers in addition to writing down names. If you're required to get pre-authorization, request it sent by mail or email and keep it. If you fail to get required prior authorization for a certain service, it can be difficult to get the service approved later. For example, one of my colleagues spoke with a young man whose pre-authorization request for a follow-up PET scan was denied for some reason. He didn't think it was a big deal, went through with the scan, and ended up with a bill for $6,000, which he then struggled to pay. Open all mail, even if it seems daunting. Review all bills. Compare them with your explanation of benefits, or EOB. Insurance EOBs explain what you owe the provider. Mistakes happen. Prescription drug copays are especially expensive these days, especially for new therapies that have no generic equivalent. Someone with cancer may not take their medicine as directed so that they can save money on copayments. People often encounter issues with medications not being covered. I'll just quickly introduce some common issues with coverage of medication. Some reasons medication might be really expensive or not covered. It can be difficult to get off-label drugs covered by insurance. Most insurance policies have what's called a prescription drug formulary. You might have heard that word before, but basically it's a list of medications your insurance company will cover at different percentages, usually tiered low to high. For example, a generic drug may be lower tier, meaning it comes out at a cheaper cost to you, while certain brand name medications are at a higher tier, meaning the insurance pays less and it costs more out of pocket for you. You can ask your insurance company, or if you have Medicare Part D prescription coverage, for a copy of your insurance formulary. Patients or providers can petition for an exemption, which is kind of like an informal insurance appeal. If you have issues getting a certain medication paid for, you might be able to use discount pharmacies or coupons to cover certain medications. Or if the issue is your insurance, they can help you figure out what to do next. Sometimes the cash price for a generic medication can even be cheaper than a copay through insurance. So it can be worth asking what the cash price is for some medications. Sometimes it also makes sense to do mail order, which may or may not save you money on copays, but also could save time or money spent to get to and from the pharmacy. Your insurance might have you do step therapy. That means you may have to try less expensive medications first and demonstrate that those didn't work before your insurance will pay for medication your doctor originally requested. Or if you need a medication covered for which your insurance denies coverage, your doctor can help you appeal with the insurance company to try to get it covered as medically necessary. The CLRC website has insurance appeals information as well as a fact sheet on accessing prescription medications. Another way to minimize financial toxicity is to make sure that your health insurance plan is covering the costs that they're supposed to, those that are medically necessary and covered under your plan. Private insurance companies have different procedures for appeals, and it varies by state. The process for completing the appeal should be found in the denial letter sent by the insurance company and should also contain information about the strict timelines that must be followed for a successful appeal. When you go through the appeal process with the insurance company, this is called an internal appeal. If you're unsuccessful with an insurance company's internal appeal process and they still deny coverage, it doesn't have to end there. You can request an external review through the state with a third party, and that decision is usually binding. This is called an independent medical review or external appeal because someone else gets a say in the appeal. Typically, you have to go through the insurance company first, unless the issue is urgent. Often, medical teams are unaware of insurance difficulties that patients face. Your medical team may be able to either help you appeal or help you go another route so you don't suffer with so much out-of-pocket expense. This is just another reason to get familiar with your insurance policy. If you don't know what's supposed to be covered, how will you know to raise an issue if your insurance doesn't pay what it's supposed to? Now, if you have Medicaid or Medicare, the procedures are different, and I won't go into detail about that here, but you can contact your state Medicare agency for appeal information. If you have Medicare, your local SHIP office is a good resource. As I mentioned at the beginning of the presentation, many of the practical financial concerns of people with cancer are related to or a result of a combination of high medical expenses and loss of income. Some would argue that the loss of income is the most important financial concern. So I want to quickly touch on job and income protection. Having adequate health coverage or focusing on reducing healthcare costs simply isn't enough to address these concerns. This is the shortest section of this presentation, but literally worthy of its own presentation. We have a lot more resources on these topics on our website and YouTube page. Cancer-related financial toxicity often springs from people losing income due to needing to take time off work, either for themselves or a loved one dealing with cancer. There are medical appointments to get to, physical recovery from cancer treatment, whether it be surgery, physical therapy, chemo, or other medical treatment, fatigue from having gone through medical treatment, or unfortunately, people sometimes lose their jobs due to discrimination or they exhaust their medical leave. So it's important to understand there are laws that protect people in the workplace. And even if your job is protected, that doesn't mean your time off will get paid. Insurance and income are important, so I want to talk about some laws that provide protection in the workplace. I'll discuss income replacement on the next slide. It's important to know job protection and income replacement are not the same. When someone says they're, quote, out on disability, it's not clear whether that means they're on disability leave, receiving disability benefits, or both. A lot of people with cancer don't realize that they're potentially protected by disability anti-discrimination laws. That's a big point. In a lot of cases, maintaining employment is the most important thing to prevent financial toxicity. FMLA, the Family Medical Leave Act, is the law that provides people with some job and benefit protected medical leave for themselves or a family member. If you work for a public agency or private employer of 50 or more employees within a 75-mile radius, you could be eligible to take up to 12 weeks of job protected medical leave and get the same job and benefits when you go back to work. Some states have a similar law, and some employers provide medical leave similar to FMLA. Again, this is just a 30-second overview of a very complex law. You may need to work with your doctor on medical certifications. The American with Disabilities Act, or ADA, is the federal law that protects people with disabilities from discrimination at a public employer or private employer with 15 or more employees. This is something that a lot of people don't know, but cancer can be considered a disability under the ADA definition. So you may be eligible for a reasonable accommodation in the workplace, including physical adjustments to the workplace or adjustment in company policies. The CLRC has publications on its website dealing with protections in the workplace and how to speak to an employer about a cancer diagnosis. It's important to understand your rights early on. The CLRC website has a repository of information, and please check out our website to see additional webinars and handouts. Again, maintaining employment when at all possible is imperative in avoiding financial concerns. So it might be helpful to ask your doctor to suggest accommodations that you may be able to use at work. Some states have expanded protections and apply to employers with fewer employees or specifically include cancer in the definition of disability. So, for example, some states offer anti-discrimination protection for people who work for employers of fewer than 15 employees, or expand the definition of disability so more folks are covered. Again, this was just a super quick intro, so you know that there are job protections. Now I'll give you some information on income replacement. And after I go over income replacement, we'll get into COVID-19 resources. Here are some options for income replacement if you're either out of work on unpaid leave or unemployed or unable to work. We often hear from patients and survivors who are unaware of their potential eligibility for these programs, so anything you can do to get informed about these programs may be helpful. The Social Security Administration offers 2 long-term disability programs in addition to providing retirement benefits. The first one, SSDI, or Social Security Disability Insurance, is based on work credits. In other words, you pay into the system, so you're essentially insured. You can log onto the Social Security Administration website at ssa.gov to view your eligibility. SSI, or Supplemental Security Income, is based on being low income and having limited resources. You have to qualify based on income and bank accounts and things you own. The definition of disability is the same for both. Essentially, you have to be unable to work for 12 months or more or have a terminal illness. Cancer does not mean automatic approval in every instance, and the approval process can take months. Some states have their own short-term disability programs, but very few states provide income replacement for employees. Private disability insurance refers to a policy you bought on your own from a company or broker, or one you get through your work. Be sure to review the policy. The Affordable Care Act pre-existing condition protections do not apply to private disability insurance. That means if you don't have disability insurance and are diagnosed with cancer, you can still be denied disability insurance or charged a lot more for your policy. One tip for those with financial concerns is to read the fine print of any policy. Most require offsetting with SSDI, so it's important to understand exactly how much income to expect. Now, I want to get into COVID-19's financial impact. It's really important throughout this presentation that I share with you the resources that are available before and after COVID-19 protections. So I want to also make sure to go over the resources available because of COVID-19. So first of all, the Families First Coronavirus Response Act, or FFCRA. This law applies from April 1st, 2020 and expires on December 31st, 2020. It applies only to employers who employ fewer than 500 employees. This legislation is limited to only this coronavirus pandemic. It provides for paid leave for employees affected by COVID-19 if those employees are unable to work or telework. Unlike regular FMLA, which requires someone to have worked for at least 12 months and worked for at least 1,250 hours in the last 12 months, employees are eligible for the Emergency Paid Sick Leave Act, or EPSLA, if they have worked at least 30 calendar days. This provides 2 weeks of paid sick time at the employee's full regular rate of pay, subject to dollar caps. If an employee is furloughed or laid off, they are not entitled to paid leave. This legislation provides employees with payroll tax credits to offset all costs of providing this paid leave. There's also 2 weeks of paid sick time at 2/3 pay if the leave is due to caring for others. For example, a sick or quarantined family member, or a child whose school is closed or whose childcare provider is unavailable due to the coronavirus. Businesses with fewer than 50 employees may be exempt from the requirement to provide leave due to school closings or childcare availability if providing this leave would jeopardize the viability of the business. The Department of Health and Human Services has not yet explained what conditions, if any, would fall into the last category listed here. Total pay is capped at $200 per day. An additional 10 weeks of paid sick time is provided at 2/3 pay if the leave is due to caring for a child whose school is closed or whose child care provider is unavailable to the coronavirus. If an employee has already used 12 weeks of leave under FMLA or other reasons, they're not eligible for EFMLEA, the Emergency Family and Medical Leave Expansion Act. The Coronavirus AIDS Relief and Economic Security Act, or CARES, was signed into law on March 27, 2020. It allows broader access to unemployment insurance for employees laid off or away from work for certain reasons caused by COVID-19. The federal pandemic unemployment compensation provision provides an additional $600 a week on top of their current unemployment insurance payment for each week of unemployment between April 5th to July 31st, 2020. I want to make sure to reiterate that these resources are not specific for people with cancer. They apply to anyone that falls under these laws, but this is important and relevant to people with cancer because, as we discussed, job security, money from income is very important in addressing financial toxicity. The pandemic unemployment emergency compensation provision provides an additional 13 weeks of unemployment insurance payments for those who have otherwise exhausted their unemployment insurance benefits, which normally last for 26 weeks. The pandemic unemployment assistance provision allows states to provide unemployment insurance to those who are traditionally not eligible for unemployment insurance, such as those that are self-employed or who are independent contractors. And there's certainly a lot of people who are self-employed or working as independent contractors, so that is a very helpful provision. The eligibility for unemployment benefits is also expanded to include those who can't work because of quarantines, caring for a loved one with COVID-19, and caring for a child who's at home because their school or daycare is closed. However, if someone resigns from their job only out of fear of contracting COVID-19, they are not eligible for these unemployment benefits. Now, this is a long list, but wanted to make sure to go over additional information so that you get the entire picture of resources available as a result of COVID-19. So the CARES Act economic impact payments. It provides payments to households of up to $1,200 per adult for individuals whose income was less than $99,000 and $500 per child under 17 years old. Additionally, the IRS will generate $1,200 economic impact payments to Social Security recipients who did not file tax returns in 2018 or 2019. These payments will be sent or have already been sent automatically to most of those eligible to receive them. CARES Act eviction moratorium. For a 120-day period beginning on March 27th, depending on the type of housing you have, a landlord cannot initiate a legal action to recover possession of the home from that tenant for non-payment of rent, which is commonly known as eviction, or impose any penalties or fees on the tenant for late payment of rent. CARES Act mortgage relief. For federally backed mortgages, you may have heard them like FHA, Fannie Mae, Freddie Mac, lenders cannot foreclose for 60 days after March 18th. Furthermore, one can request a forbearance of mortgage payments for up to 180 days and an extension for an additional 180 days. To be clear, the mortgage payments are not forgiven, they're only postponed. Also, many banks have offered support, including payment deferrals and suspension of foreclosures and repossessions. Please check with your bank to see what help is available. Student loans. So for federally held student loans from March 13th through September 30th, 2020, the interest rate is set at 0% and payments are suspended for student loans owned by the federal government. The federal student loan servicer will suspend all interest and payments without any action from you. The CARES Act also requires all health insurance companies to provide free COVID-19 testing without any cost sharing, including deductibles, co-payments, or co-insurance, as well as the cost of doctor visits and tests related to an evaluation of COVID. For example, if your doctor wants to test the flu or perform other tests as part of the evaluation for COVID, both the doctor visit and these other tests must be provided without cost sharing. And Medicare covers the cost of lab tests for COVID-19 with no out-of-pocket expenses. Medicare covers all medically necessary hospitalization. This includes if you're diagnosed with COVID-19 and might otherwise have been discharged from the hospital after an inpatient stay, but instead you have to stay in the hospital under quarantine. The IRS and state governments have postponed the due date for both filing taxes and paying taxes owed until July 15th, which could provide some flexibility when trying to juggle bills and tax obligations. Many of the major credit card companies are offering help with bills, including removing minimum payments, waiving late fees, and reporting delinquent accounts to the credit bureaus. We're not endorsing any particular credit card company, but check with your credit card issuer to see what's available. Many states have also imposed moratoriums on utility terminations of service. So more than 700 companies have already pledged to the FCC not to terminate service to homes and small businesses who can't pay their bills due to COVID-19, and also waive any late fees. This isn't every resource available, but it covers the major ones. And all of these resources we discuss are especially relevant. And now that the United States is aware of the financial impact of those affected by a medical situation, now is the time not to be shy, but to ask for help, stand up for yourself. Financial institutions and healthcare providers may be more receptive to your situation. I'm just going to pause for a moment. Here are the resources regarding the information on COVID-19 mentioned. And this presentation is being recorded, so you don't have to write down every single website, but I wanted to make sure that you had them on your screen. And here are some additional resources regarding the information on COVID-19 that I'm mentioning. So now moving on to preventing financial toxicity and addressing practical financial concerns. To recap, we should have insurance, understand how to use it, understand that appeal rights exist. We should make sure our income is protected and understand what disability benefits for which we may be eligible. We've gone over all this so far, so you can feel really good that we've already covered so much information that can be helpful. Well, even if we've done all that, we can still be subject to debt or financial trouble. So what do we do then? That's what the rest of this presentation will focus on. If you or someone you know has cancer or another illness and is on the hook for medical bills, I'm going to go over some information that should provide some guidance. I want to talk about balance billing, financing, consumer protection laws, and bankruptcy. At the end, I'll briefly show you some websites and resources, so when the presentation is available on our website, you'll have all the contact information you'll need on this webinar. What if your insurance has paid what it's going to pay and you still get a huge medical bill? Where do you start? I won't go into detail about everything on this slide. The one important thing I want to point out is that many patients are unaware of is the ability to negotiate a medical bill. We frequently hear from patients who are unable to pay the full amount they owe to a hospital or provider and have no idea that they may be able to pay a smaller lump sum or set up a payment plan. If you think that there's an issue, first, contact the creditor. When you get the billing department on the line, request that your bill be put on hold from collections and your account status be changed to pending. Then request a line item or detailed bill, especially for hospital bills. Line item bills detail every single charge. Confirm that your insurance was billed. Sometimes providers send bills before the insurance payment is reflected. Credit reporting bureaus are required to wait 180 days before putting past due medical debt on a credit report so that patients can work on getting their bills paid. Make sure every single item on the bill was actually ordered by your physician in writing. If your doctor did not order a test or procedure in writing, you cannot be charged for it. Look for duplicate charges. Look for what's called upcoding. This is when a provider bills for a more costly procedure than what was actually performed. Compare the codes in your medical records against your detailed bill. If it looks like the charges are valid and you can't pay it all now, you can set up a payment plan or try to negotiate a smaller lump sum. If you've determined that there are charges you can dispute, write a medical dispute letter to mail, fax, or email. It's important to have it in writing, and if you send it by mail, send it certified so you can confirm receipt. Write the letter as soon as possible. Of course, you'll want to put your account information, details on the charges you're disputing, like date, time, facilities, physician name, code number, and a statement that explains why you're disputing certain charges. Attach any supporting documentation you have. Once you've disputed any errors, you can also make sure the hospital is being fair in its pricing. There are tools online you can use to see whether the prices you are being charged for services are fair. If you find that your bill was way out of line, use that information to get your fees lowered. You can estimate procedure costs from websites like Clear Health Costs, Fair Health, healthcarebluebook.com. Also, you can look up the Medicare reimbursement rates for your specific CPT code. CPT codes are the description of what the patient or yourself were charged. The medical reimbursement rates will be a fraction of what you were charged. You can use them to negotiate the rate. You can also request that the hospital reduce your rate to the industry standard. Another option, if it's warranted, is to file a complaint with the Department of Public Health or Insurance in your state if you're just not getting anywhere with the hospital. Some states have laws limiting how much hospitals can charge patients who pay for care on their own, considered self-pay patients. If the task of reviewing a lengthy hospital bill seems impossible given your circumstances, you could consider talking to a medical billing advocate or attorney. Medical billing advocates either charge an hourly fee or percentage of what they save you. Additionally, some hospitals have financial navigators, and that can be beneficial to hire or consult with a financial advisor. I want to talk about balance billing. Some people think that if your health insurance pays your medical provider, that means that insurance company has paid the entire cost of care to your provider. That is, besides your copay or deductible. Not the case. If your provider accepts your insurance or accepts assignment from Medicare, the provider has agreed to be paid what the insurance will pay them and accept that payment as payment in full. When your insurance, whether private insurance, Medicare, or Medicaid, pays the provider, they're paying a contracted rate to the provider. For instance, a provider's service could typically be $500, but they agree to be paid $300 from your insurance. That's the contracted rate between your insurance and the provider. $300 if you visit any in-network provider and get services covered by your insurance plan. They have a contracted rate they agree to accept from your insurance, so you cannot be billed for the balance. In this example, the remaining $200. To bill you for the balance would be violating the contract between the provider and the insurance company. However, if you go outside your insurance network or get care that isn't covered under your policy, then you can be held liable because in those cases, the provider has not negotiated to accept a certain rate. And it's under no obligation and no contract. So it's not illegal if your provider is under no contract. If you run into this issue, you may be able to file a grievance with the insurance plan, so they're on notice that their provider is violating their contract. Surprise bills. So we should be familiar with our policy and make sure our providers are in network. But we know we'd end up on the hook for more out-of-pocket expenses if we do see an out-of-network provider. But what if you've done that? You schedule surgery with an in-network surgeon at an in-network hospital. Then you get a bill for the out-of-network anesthesiologist that you didn't pick. Sometimes this happens to people and is known as surprise balance billing, where the provider bills you for the balance the insurance didn't pay. This has to be illegal, right? Well, unfortunately, there are no explicit federal protections against balance billing, so it's not illegal federally, but some states have stepped in to protect consumers from this costly and confusing practice, but the protections aren't adequate. There are some new surprise billing laws for 2019, and so there is a little bit more traction in that direction. Many states have laws that prohibit the hospital or provider from sending the balance bill, and many states have laws called hold harmless laws that require insurers to hold consumers harmless from the bill charges of providers. A few states have hold harmless protections, but no prohibitions on sending balance bills. Because these hold harmless states do not prohibit providers from balance billing, consumers can still be billed and will often pay those bills. Providers in these states may send surprise balance bills in the hope that patients will not complain to their insurer or state insurance department. Any family facing cancer is going to have some out-of-pocket costs. It could be hundreds of thousands of dollars. Providers are now offering ways of financing what you owe. Medical providers will often require you to demonstrate your ability to pay before agreeing to treat you. That's normal unless you're in need of immediate life-saving emergency treatment. Providers know most people don't have this kind of cash on hand and want to ensure that they're going to be paid. Your facility may offer options like a medical credit card or a private loan through a partner lender to patients seeking care. It's really important to do your research. Take a little bit of time or ask someone to go over the terms if you choose to finance a medical bill, so you have another set of eyes before you sign. Don't sign on to a loan or card without researching. Some medical credit cards like Care Credit and some other companies offer 0 interest for 18 months or some terms like that. It may seem like a no-brainer, but consider your budget. Even at 0%, could you afford to pay off the whole balance in 18 months? That's important to think about because after 18 months, the interest rate will go way up to something like 26% or so. And with that interest, it may become impossible to pay off that balance. If the hospital says they have a lender they're partnered with, find out what the hidden terms are there. And as we're often warned, if it sounds too good to be true, it is. It's okay to be skeptical when it comes to loans. This is another example of where it makes sense to talk to your provider. If they are recommending something that you can't afford and might need to take out a loan in order to pay for, maybe they can offer an alternative treatment that is covered by your insurance, or maybe able to work out with you on your cost sharing. A recent article by Kaiser Health News shared that hospitals are increasingly asking patients to sign up for these loans while the patient is still being treated and doesn't have the capacity to do their due diligence, like when someone's lying in a hospital bed. So just wait till you get home to make a decision, even if the hospital staff is pressuring you to make a decision right then and there. Don't be tempted to make a decision under pressure. Find out if you qualify for low-income assistance before committing to certain repayment terms. Because cancer is so expensive, people often need help and elect to fundraise. Even with insurance covering most of the medical burden, people may fundraise to help cover costs like being out of work, co-pays, etc. Asking for help is a good idea, but if you get cash help from someone, use caution. If you are receiving government benefits like SSI or Medicaid or charitable health care through the hospital where you receive treatment, you should speak with someone familiar with the eligibility requirements for the program you are on to make sure your cash gifts do not disqualify you. Government programs have strict income requirements, and cash you receive could disqualify you from these programs. For example, for SSI, income is defined as anything you received during a calendar month and can use to meet your needs for food or shelter. It may be in cash or in kind. Income is not cash, it is food or shelter, or something you can use to get food or shelter. So let's say a fundraiser is set up for someone who's on SSI and has Medicaid tied to their SSI eligibility. Even if the fundraiser raises only a few $100s, depending on the patient's situation, if that money is transferred to the patient, it could put them over the income limit for these programs and jeopardize their benefits. The value of SSI and Medicaid to the patient is likely much higher than what a small GoFundMe fundraiser could raise. So we just encourage people to exercise caution so that no one has to worry about repaying benefits to the SSA or get concerned about their benefits being terminated. So one option to help avoid jeopardizing benefits would be for someone else to use the funds raised to pay directly for medical bills or other things that are not food or shelter for the patient. So Medicaid and other means-based programs may have other definitions of income. So it's always a good idea to confirm that information prior to setting up a fundraiser for someone. Now let's talk about prioritizing expenses. Sometimes there's simply not enough money to go around. If bills continue to come in or debt continues to rise, one thing that can help alleviate a little bit of the burden, at least temporarily, is to prioritize the most important expenses. For example, if someone has debt that has been secured with collateral, such as a mortgage or car loan, it may be important to prioritize those expenses or risk repossession or foreclosure. If you stop paying a car loan or mortgage, you risk losing your home or car. Now, just getting back to the fact that we did go over some additional COVID-19 protections, which are relevant to consider, but we also want to familiarize you with information after those COVID-19 protections are no longer there. Maybe you live somewhere with excellent public transportation, other transportation options like Uber, taxis, and in that case, giving a car up isn't a big deal. Or maybe a household can get by with one car instead of more than one car. Even if you don't own your home, it's important to pay attention to due dates for other essential things like rent for an apartment. Again, we went over some COVID-19 resources that might be more helpful in these situations, but one thing that happens is we will receive calls from patients or survivors who have housing issues because they weren't able to pay for their rent or mortgage when their medical bills started piling up. Now, of course, we think of medical bills as necessities, but in a lot of circumstances, patients are able to continue receiving care despite having large bills. And there might be some flexibility with respect to repayment timing and options. So it's important to be able to pay copays when you go to the doctor, and you can be turned away if you can't afford them. But if you risk losing your home or car, you may want to prioritize those payments over, for example, a credit card bill. Now, we are down to just a few minutes, so I'm going to go over some of these resources a little bit more quickly, but I want to make sure that we do cover these important points. If you do end up owing a balance that you can't pay off, medical debt or otherwise, and it becomes delinquent, this is certainly not uncommon in this world of incredibly expensive medicine and when there are a lack of income replacement programs. The Fair Debt Collection Practices Act protects consumers from harassing collection practices by debt collectors, like collection agencies. A debt collector is different than a creditor. A creditor extends credit to individuals. That's the original person who extended you the services. So debt collectors are required to disclose their debt collectors and are required to send written notice about the debt. And they're not allowed to harass individuals or make false statements. If you learn that you owe money, ask the bill collector about it. Get a copy of your credit report and check it. Ask the collector for more information. Give their name and address and request information about the debt in writing. Make sure it's legit. There's so many scams these days where scammers get people on the phone and try to convince them to make an immediate payment over the phone. But this is not a good idea if you don't know who you're paying or why. There are also time limits for collecting a debt called statutes of limitations, which vary from state to state. When you get confirmation of the debt you owe, you may want to check about the statute of limitations. Sometimes it doesn't make sense to pay a past due debt that is about to fall off of your credit report. If you owe the money but can't pay it, sometimes debt collectors will be sympathetic if you offer to pay a reduced amount, especially if the debt is older. You can try to negotiate. And this is just a really important takeaway, once the bill has been sent to a debt collector, it may have a larger impact on your credit score. So it's usually better to try and negotiate and set up a payment plan with the hospital or provider directly instead of doing so with a debt collector. Sometimes we hear from callers who are concerned about their liability for their own debts or debts of someone else. In general, if someone dies and has amassed debt during his lifetime, his estate would have to pay the debts before his heirs would receive any of this property. While a spouse is not always liable for the debts of the other spouse, there's something called the doctrine of necessaries, which applies in most states but not all, and which does make spouses potentially liable for necessary expenses or debts, such as medical bills, utilities, rent, food, and clothing. Unfortunately, This means that the widow or widower is responsible for paying off the medical debt of their deceased spouse. That being said, this liability generally does not pass to anyone else, like next of kin, unless someone has explicitly agreed to be responsible for the medical bills. I caution caregivers against signing anything at the hospital regarding billing or payment unless they want to be on the hook for more bills. Debt collection lawsuits. Okay, so what if you can't dispute and can't pay a debt? Should you be worried about a lawsuit? It depends. Each state, as I said, has statute of limitations or a time limit when a debt collector can sue you. So you might not need to worry about really old debt, but it's always a good idea to check with a lawyer first. And if you're actually sued for past debt, a lawyer might raise that as a defense to a lawsuit. You can always call the CLRC, or most state attorney general websites have consumer information about debt collection and statutes of limitations. If there's a judgment entered against you, there are maximum amounts of how much your wages can be garnished in most circumstances. The Consumer Credit Protection Act limits how much can be taken from your checks each week. One of the slides I'm including is a link to a page explaining those rules. But essentially, as creditor is limited to 25% of your disposable earnings above $290 a week. And certain wages are exempt from being garnished, like Social Security benefits, Supplemental Security Income, SSI, disability benefits. And if you owe child support or spousal support, there are a lot of potential consequences, including wage garnishment. And the Consumer Credit Protection Act allows your wages to be garnished up to 50 or 60%. The consumer protections about wage garnishments do not apply to federal or state tax debt. Bankruptcy. So some people have no choice but to file bankruptcy. This might be the only option for some people of moving on from huge medical debt or a lawsuit judgment. There are two types of bankruptcy. A Chapter 7 bankruptcy is a liquidation of bankruptcy, where all your unsecured debts like medical bills, credit cards, and judgments are discharged. In a Chapter 13 bankruptcy, you make a plan to repay debts. It's a reorganization. You'll make payments to a trustee who will distribute those payments to your creditors. It's a good idea to talk to a bankruptcy attorney if you're considering this option so you fully understand the implication. Bankruptcy stays on your credit for 10 years, but many people are extended credit after a short amount of time after a bankruptcy. So you should ask an attorney whether bankruptcy makes sense for you. Some things that are never discharged in bankruptcy are court fines, restitution you owe, child support, spousal support, or alimony. And then student loans and tax debt are mostly not dischargeable in bankruptcy unless you ask for and are granted an extension. The CLRC can provide patients with lawyer referral services in their area, as well as provide lawyer referrals in many states. So, and some legal aid offices handle bankruptcy. So definitely an important thing, and contact the CLRC if you have questions about bankruptcy. Insurance. Here are some places to get insurance information. Contact the CLRC if you want to ask about COBRA, marketplace insurance, Medicaid, and insurance appeals. We have a comprehensive website with fact sheets, or ask a question for individual assistance. And for more specific help on Medicare, here are some resources that can help with your individual questions. SHIP is a great resource. The first resource is related to the fair debt collection practices I mentioned earlier in the presentation. I'm leaving you with a few medical billing resources here. We don't endorse these or any other companies. Here's another resource, the Patient Advocate Foundation, that can help you with case management for you and your health insurance issues. If there's a debt collector harassing you or you're worried about a lawsuit or wage garnishments, check this video out from the FTC. Certain benefits are exempt from wage garnishment, as I said, and here's a bit more about that. To find a lawyer, contact the American Bar Association, Legal Help, or lawhelp.org. Now, finally, we're just at the end of the hour. There's a condensed introduction to a lot of money-related topics and COVID-19 related resources. All of these topics are things that you find information about on our website. Some of these topics are things we have fact sheets on. The intake for customized information. We're limited to 1 hour webinars, so this had to be quick. And even that is way more than the average human attention span, so thanks for hanging in there. And here's a recap of what we covered today. Thank you so much for your time. I'm going to stop the recording now and take a question if there are any. Thanks so much for your time.